Okay, so today we're going to go ahead and do a needle decompression. This is going to be indicated whenever we have absent lung sounds on one side, which again is going to be part of our pneumothorax treatment or even tension pneumothorax. Never forget that we're going to be using our own protocols, however we were trained. So this is just one way to do it. Like I said, remember that you're using your protocols and you're following what your medical director wants you to do. The first thing we're going to do is as we're ventilating the patient, we're going to listen to our lung sounds and make sure that we're getting that good compliance. And we're going to notice that we're missing lung sounds on one side or they're severely diminished compared to the other side. And that's absolutely an indicator for needle decompression. The first thing we're going to do is we want to prep our site. So the main site that we're using in this video is going to be the second intercostal space in between the second and third rib. So remember that collarbone is rib number 1. We have a space, rib number 2, a space, and that's going to be our second intercostal space, and we're going to go in between the third and second rib. Again, we're going to go mid-clavicular in that second intercostal space. So I want to make sure that I prep my site real good. We're going to do little circles to big circles to make sure that we have all the dirt and grime off the patient's chest. While that's drying, I can prep the rest of my equipment. I'm going to be using a 14 gauge needle, and we know that this is our decompression needle since it's so much longer. It has a much more rigid catheter, so it's not going to collapse under the pressure of the tissue. We're going to be using a stopcock in order to create a valve to bleed off more air as it builds up. 2 pieces of rolled up gauze to stabilize our needle, and then we have tape to secure everything down. So now with this all dried up, I can open up my needle. And again, so I have collarbone, rib number 1, space, rib number 2, space, rib number 3. So we want to go favoring the top side of that third rib. A lot of our vasculature is underneath the rib, so we want to make sure that we're not hitting any of that. So again, we're going to go above that bone. And right now I just hit the bone, and that's okay. So I'm going to take out a little bit, angle up, and now I'm past that bone. We're going to go ahead and keep advancing until we hear a rush of air. Once I hear that rush of air, I'm going to take my needle out. This is going to go in the sharps container. I'm going to put my valve on. So right now we're in that pleural cavity where that air is at. I have my stopcock right now off to the patient. I can bleed off whatever air is left. Close that. And now that bought us a little bit of time so we can go ahead and secure everything down. We're going to take some gauze. Go ahead and turn that. And now that my decompression is in place, I want to go ahead and reevaluate, and I should have much better lung sounds on the affected side of the pneumothorax. Just keep in mind, as we ventilate the patient, the original problem is going to present itself again, and we're going to build up pressure in that thoracic cavity. So every couple of minutes, I want to go ahead and bleed off air and close this again, and that's going to be evidenced by decreasing lung sounds on that side. From here, the gauze will go ahead and absorb any little bit of blood that's coming out, and we'll go ahead and continue evaluation, continue bagging the patient, perform what other interventions are required.